So this is the farm. We talk about bisphosphonate. An example, I told you they are Adronate. Know the last name and you'll be able to recognize them. So Alendronate is the common one. There's another one is Risidronate. All this can be taken daily, weekly, or monthly. There's one though that is only giving, I will put it in capital, Zoledronate. This is the only one we give it through IV and is annually. Therefore, if they cannot take these two, they have to take this annually. And what is the function? To prevent and treat osteoporosis. Basically, you prevent and treat osteoporosis or bone mineralization issue. If you have hypercalcemia, if your calcium is also high, we can use this to block the calcium from being released again. What you need to tell them is how to take it. You take with full glass of water. In the morning, empty stomach. Okay? Remain upright. These are all testable questions. This is selected, applied, 30 minutes. This is the way you got to tell them. 30 minutes after taking it, they have to remain upright. Note, side effect is esophagitis. This is why. That is why they have to. So they take it with a large amount of water. So they at least 8 ounces, a full glass of water. That's, you have to teach them. It's very, very important. They may trap you. They say, hey, can they take it with what? Orange juice, negative. Can they take it with antacid? Negative. I told you I hate antacids. Okay. Caffeine, negative. No calcium. Okay, so these are some of the things they can put in select or apply questions. If they have esophagitis, or they have restriction, or they have swallowing problem, well, no, do not take, avoid in this patient. Because the thing is going to cause esophagitis anyway, going to cause stricture, therefore we don't want you to take it. The only medication they will take is the IV form, Zoledronate, which is given by IV. Okay, so that's the first medication. This is for musculoskeletal problem. Unfortunately, they can still take NSAIDs, right? But you know, I mean, I have a good lecture for NSAIDs, all the classes of NSAIDs. So you can take ibuprofen to help with the pain, right? You can take indomethacin. You can take Celebrex. You can take Toradol, ketoconazole, right? All these are NSAID. This relieve inflammation. But you know, NSAID is bad, okay? GI bleed, kidney issue, hypertension, cardiac issue. We pop it like that, but it has so many side effects. And therefore, they have to watch that. You got to teach them to pay attention to those side effects. Okay, what is the teaching? Full glass of water. Okay, or with food. And use it as needed. Not every day you're going to pop like a candy. No. Otherwise, you get a problem in it. Okay. Then I talk about this briefly, calcitonin. Just I want to mention it so that you know. This will prevent bone breakdown. So somebody with hypercalcemia, you can use this. Somebody with osteoporosis, you can use it. Any bone that is being broken down, we can use calcitonin to stabilize bone breakdown. The DMARDs. The DMARDs, what they do is like hydroxychloroquine. So what they're going to do is slow down the joint degeneration. They're going to slow you down and progression. What was I saying? So methotrexate is example. This is teratogenic. So you tell them avoid pregnancy as much as possible. Okay, they should avoid pregnancy. It's also liver toxic, okay, and kidney. So if you have liver and kidney issue, yeah, we cannot give it to you. So avoid pregnancy as much as possible. Hydroxychloroquine. If they're going to give you this question, watch for retinal damage. The patient is a rheumatoid arthritis, is on hydroxychloroquine for rheumatoid arthritis. What should you worry about? Retinal damage, number one. Okay. Of course, they can give them immunomodulators like infliximab or adalimumab or the etanercept. I'm mentioning them so that when you see them, you don't worry about it. These are all immunomodulators. We can use it for this like rheumatoid treatments because they're immunomodulators. All this, it's what should you worry about? Like only few things. They are all neutropenic. You don't have to memorize neutropenic. So they take neutropenic precaution. They have risks of infection. You teach all the teaching that you know. You bring whatever you know, you bring it back here. You watch them, you check their CVC, you make sure any signs of infection is a problem. I need to see you. You monitor the eye. So they are going to be leukopenia. This methotrexate hydroxychloroquine can affect the immune system. All of them is going to decrease. It's the same thing all over, nothing new. So you're just applying your knowledge. So I know it's immunocompromised, so I have to worry about it. They'll give you rheumatoid patient with autoimmune, with taking all this medication. Then you say, oh, well, it's an immunomodulator. I don't even have to worry about the rheumatoid. I'm now a pharmacology question. Okay. So you can also take steroids, glucocorticoids. Remember, this is to provide relief and inflammation. But guess what? They have to trade all the side effects of steroids. I'm not going to list all of them, but think about it. Somebody on steroid, they gain weight gain, right? They are risks of infection, right? What else? Hypertension. Their potassium is low. Sodium is high. So all the things that you know will happen, you got to teach them so that they should know that. Okay, they're going to have weight gain, they're going to be a problem. And the number one is do not stop abruptly. Otherwise, we are in trouble. You go into what? Addison crisis. So you have a patient that now is rheumatoid, you're talking about endocrine, it's connected live. They are in shock, you got to manage them. Then anti-gout. Anti-gout, allopurinol. I'm going to spend some time here because this is very important. This is affect uric acid production, right? And it's used for chronic, not for acute problem, chronic gout. Side effects. Number one is a sulfur drug. Therefore, they have photosensitivity, Stevens-Johnson syndrome, and agranulocytosis. Sulfur drug. So if they tell you small rash on my chest, well, stop medication immediately. Otherwise, we have a problem. So those are the teaching you're providing. So a patient taking allopurinol call you, they said they have a rash, stop the medication. Don't take anymore, come back, otherwise we'll get into trouble. Okay? They take the medication with large amount of water. Okay. And then because it affects the kidney, so avoid in patient with kidney, liver issue. You need to check the uric acid and make sure the levels are okay so that you can titrate it. Common side effect, the GI, don't worry about it. Don't worry about it. So this is normal. But if they call you and they said you have rash, yeah, it's not normal. We got to do something about it. If they are on allopurinol and they get acute gout, then you give them colchicine because it's an NSAID. That will take care of it. Question on the board. Celebrate is not teratogenic, it's cardiogenic. It causes heart problem. So celebrate, it causes heart issues. So we should avoid it. That's the black box on it. You should not take it if you have a heart problem. Then there's this, they can trick you. You see, everybody need calcium, right? So calcium carbonate. How do you take it? You have to know how to teach a patient how to take it. You say, oh, I need calcium, go take some calcium supplement. But if you don't teach them, they don't know all of them. What is the side effect? Think about it. If I give you calcium, I make you hypercalcemia. What is hypercalcemia? Symptoms, which direction? Everything goes up. No, everything goes down. Goes down. If everything goes down, well, you get constipation, right? Just some depressive symptoms. Some pain, your fatigue, body pain, aches. I don't know, one side effect is constipation, so don't worry about it. What do? Take calcium, you have constipation. You giving stool softener? I would love to get it. Do you? No. Don't give them stool softener. Drink 2 to 3 liters of water a day. That's the treatment of constipation. Exercise. Moderate exercise 3 times a week. And what? Fiber. 30 grams, 30 to 35 grams a day. That's your treatment for that. That is the key. Okay. Then it's a muscle problem. musculoskeletal, so muscle relaxant, right? Like Flexeril. Example, Flexeril. Key word is this. This is what they will use. Cyclo, right? Benzaprine. When you see it, cyclobenzaprine, it's the same as Flexeril. They won't use this word. They will write it right. Don't get confused. This is not clozapine, okay? This is not cyclosporine. It's cyclobenzaprine. All it means is a muscle relaxant. So it's going to relax your muscle. There's a bunch of them, okay? This one, you should avoid alcohol. Don't stop abruptly, and you cause drowsiness. I'm going to say the same for everything. If they say they have drowsiness or orthostatic, yeah, just get out slowly from bed. You should avoid alcohol, but don't stop it abruptly. Then we have a problem. You get a rebound issue. Another calcium muscle relaxant is dantrolene. And I don't want you to forget this medication because you can use it for NMS, MH, malignant hyperthermia, neuroleptic malignant syndrome. It's a muscle relaxant, but it's very, very, very good. It can also be used if you have muscle spasm or anything like that. The key side effect is liver toxicity. Okay, you can't do that. And then it also causes sedation. All of them, no alcohol, don't stop abruptly, and they cause dizziness. Those are key for all of them. Then Baclofen is another muscle. I'm just giving you all of them in case you see them, but in the short form, the things you need to worry about. Okay. Baclofen is also used for muscle spasm. It relaxes the muscle spasm. It also can cause orthostatic because it gives you drowsiness. It can cause dizziness. Just don't worry about it. It can cause nausea. But the most important is this, rhabdomyolysis. So we have to worry about this one. And the last one, muscle relaxant. These are all classes of muscle relaxant which carry Prodol. It's also muscle relaxant, very, very good. But people can depend. There's a risk of dependency on this. So that's why you got to teach them. You have to be careful about it. So they taper it slowly. And they don't take any alcohol with them. These are the quick farm. These are all the muscle relaxant. If you see somewhere, it's all that you need to pay attention, know about. And these are examples of them for musculoskeletal. The last thing I'm going to talk about, I think we ran out of time. We won't be able to do some questions. I guess I'll give you some 30 minutes. Any questions so far? The last